Hi, everyone. I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening.
Hi, I'm Deb Flashenberg, and I'm your host of Yoga, Birth, Babies. And today we're going to talk about why birth preparation is so much more than hiring a doula. Years ago, I attended a workshop by the filmmaker, Deborah Piscali-Bonero. She created the film Orgasmic Birth, and she's a childbirth educator, and she's been on the podcast a few times. And in that conversation, I remember hearing her say, a doula should not be your sword and shield. And ever since hearing that, and this has been years now, I have wanted to do a podcast about that. Because many times I hear students and my prenatal students talking about how they're not quite connected with their care provider, or they don't really like the policy of the hospitals, but they've hired a doula, hoping that they can go in and have the doula kind of plow the way for the birth that they are wanting to have. So to have this conversation, I reached out to my good friend, Bec Conant. She and I go back over 2 decades. It's been a bit. Let me tell you a little bit about Bec. She is a respected figure in Boston and New England for her expertise in prenatal care and yoga instruction. As I mentioned, spanning over 2 decades. Through her own birth program, she empowers expectant individuals, guiding them through childbirth and easing their transition into parenthood. Bec is also the author of the Own Birth Approach, which explores using yoga to prepare the body, mind, spirit, and for birth. Bec and I are a bit of what I'd call birth junkies. We have many different initials after our name. She is a doula. She's a spinning babies educator, a Lamaze teacher. We did our doula training together 20 years ago. What else? She's a hypnobirth teacher. She's a mom. She has many initials, and she's so steeped in this information and this birth world and truly passionate about it. So when I wanted to talk about why birth preparation is so much more than hiring a doula, I knew Bec was the person to do this with. So in this conversation, you're going to hear us talk about the importance of investigation and education. We really, in our opinion, both Bec and I can agree on this, that childbirth education and really thinking about what you as an individual want for your birth is really the first steps. And I'm really excited for you to dive deep with us in this kind of geeky, fun, passionate conversation about birth prep. And I'm hoping that as you listen to this, you get excited to think about what you as the individual want for your birth, and then find the team that's going to support that. And even think about questions that you can think that you can kind of chew on to help you dig deeper and to help you find that support. I'm really excited for you to hear this. Now, before we get to my conversation with Bec, I always love to touch base about all the things we have going on at Prenatal Yoga Center. I mean, really the best way is to check out what's going on our website. So you can check out prenatalYogaCenter.com. And if you want to stay completely up to date, we have a weekly newsletter. In that newsletter, I give what's going on at the studio. I give birth tips and postpartum tips and pregnancy tips. I just share a lot of information and some stories and connection and wonderful pictures of our community. It's really fun. So you can check that out and join our newsletter from our website. While you're on the website, you can look at our schedule for our in-person classes, our on-demand classes, our online classes. It's all there, including information on our teacher training. We're starting to actually wrap up this school year's worth of teacher trainings, which is mind-boggling. We're already heading into the final one, which is an in-person training. We did 3 online trainings since September, each one unique and amazing teacher trainees in each one. And I'm so excited for them all to bring the PYC methodology to their community. And then we do once a year, which we're in the middle of, our in-person prenatal yoga teacher training. And then, of course, in May, we have our postnatal training. So much education and just kind of marinating in this information and bringing it to the community. It's really exciting. The last thing I just want to bring up is if you are listening and you've recently had a baby and want to share your birth story, let me know. Or maybe you are an expert and you have something to share with our PYC community. Reach out, fill out an application, or you have an idea for a topic that I haven't covered or you want a different perspective on, let me know. I'm always curious to dive into topics and bring them to the forefront here in the podcast. And then I just ask you, our listener, to please leave a rating and review of the podcast. It helps people find us. Okay, we're going to take a super quick break. And when we come back, please enjoy my conversation with Bec Conant. Hi, Bec. How are you?
Hey.
I'm so excited to talk to you, old friend.
I've been looking forward to this for weeks. Oh my God.
All right. So listeners out there, I'm just going to be super transparent. I think this is my second podcast with you.
Yes, this is the second time.
But it's not like Bec and I only know each other from the podcast years ago, many, many moons ago, when I first opened PYC, and Bec and I were young little chickens in New York City. We worked at Om Yoga together. We were so young. We worked, she was one of my original teachers at Prenatal Yoga Center, and then she jumped ship to Boston, and I lost her to Boston. But we stayed in touch online. I saw her in Boston for the Spinning Babies parent educator training. I don't even know, was that 4 years ago? 5
Something like that. 4.
It was during COVID.
Let's say 4.
4. But I always relish talking to Bec because she and I really walked a very similar path, and she's so smart. And we were both that's right. We did a doula training together.
Yes, we did.
San Francisco
with Judith.
How did we end up in San Francisco? I don't know how that happened.
I don't know. It was such a bizarre thing. Here we are in New York, and we decided to go clear across the country to get trained.
Yeah, I don't even understand how that happened. But so Bec and I know each other, so I'm just really excited to speak. So what we're going to do, friends out there, we're going to talk about doulas. So I don't know if I was taking a course with Deborah Pascali-Bernera, I think it was, and she said something so smart. She said, the doula should not be your sword and shield when heading into a birth. And ever since then, I really wanted to have a podcast conversation about the role of the doula, the importance of education, and the work of preparing for birth. And the doula can't be that savior person. There's so much before then. And it's not really the role of the doula. So when I thought of who should I have this conversation with, I'm like, oh, of course, Bec. This is the person. So that's where we're going with this. So before we jump into that, I'm going to ask Bec, which is funny. I'm going to be like, tell me about yourself, because I know, but let's have Bec tell her. Tell you guys.
Everybody knows. I know.
All right. So jump into sharing a little bit about yourself and how you got interested in birth work.
So I always say I ended up in birth work somewhat under duress because, as you know, you and I were newly trained yoga teachers, and we were all very solidly in the Vinyasa school. Mm-hmm. And the reason we ended up out in San Francisco was not necessarily because it was a doula training. We went out because it was a prenatal yoga training.
I had already done a training at that
point.
Which
I know you already had one. I'm not remembering. I don't remember why exactly you were there.
I think I went there for the doula training.
You might have. I did not realize it was a doula training. I went out. It was a full week. It was mostly to study with Judith. And then there were those wonderful 2 additional people, Ginny, and I can't remember the midwife's name, but who were teaching this in tandem. And at the end of this, I remember after this full week of just incredible dives into the birth physiology and the structure and process of labor and all this stuff, I remember they said, if you want to go on to become a birth doula, here are the requirements. And it was DONA. So it was, read a ton of books and attend childbirth classes and then attend, I think it was 3 births at the
3
time.
births.
I think now it's
and
6
some packet that you and I both forgot to get filled out properly.
Oh God, we totally forgot. I think I had 17 by the time I finally sent it all in. But it was, my initial thought was, oh shoot, I was good on the whole prep thing until you said I had to attend birth. What? I don't know what I'm doing. You got to be kidding me. And so so I went back to New York. We were both teaching prenatal yoga at various places. And at a studio up in Westchester, I had a pregnant student come up who I say the universe conspired to get me into birth work, because she just looked at me and she said, I need to ask you something. I'm looking for this thing. It's called a doula. Do you have any idea how I might find one? And I thought, well, this is serendipitous. And I said, well, I'm actually in training to be one. What do you need to know about doulas? And she got very excited. And I said, well, wait, I'm in practice. So, I have to do training first. She said, do you want to practice on me? And I thought, well, now that's interesting. Okay, sure. And the birth was amazing. It was unmedicated. It was honestly one of the moments. And when I do my teacher trainings, I actually talk about how I actually saw yoga come directly into the birth room in that birth. But I finished that birth and I came back I remember going to sleep that night thinking, I'm never doing that again. Forget it. Because it was so intense to be in that environment and to just be present at that level for somebody. And then I woke up the next morning and I had my breakfast and my coffee and sort of got my feet back under me. And I thought, that's one of the few times in my life that I had some insights that turned out to be dead on correct about how to move, where to move, how to breathe. I think if I know that, if I've understood this, I'm not allowed to not share this information. I have to, and I remember the thought of, oh, shoot, that means I got to go back. Okay, well, let's do it. And from there, I think the universe was like, all right, no, we're going to throw her a couple more to make sure she really does this because we want her in this field. But it was this feeling of, once I saw it from that side, something about it made sense. And I didn't feel like I was allowed to just go back to my blissfully ignorant world and not help people.
And just for some context, this was around 2003, I think, because I opened PYC in 2002.
2002 or 2003, somewhere in there.
Yeah. So it's been a while. And now the person also probably didn't know what a doula was. So because now it's pretty trendy. So there's also been hypnobirth training you've done, teaching, you teach your own prenatal yoga teacher training, you do spinning babies, you have a book. I mean, there's so much that you've done under your belt in over 2 decades. So how many, are you still attending births?
I'm not attending births formally. I had 1 or 2 repeat clients recently that I will come out of retirement for. But no, when I had my own child and started really leaning into my own teacher training, I started feeling like I can't really live my life on call and be present for my own baby. So because I did not have the support network around me that would let me drop everything, run off for 24 hours, and then come back, I kind of stepped out of the active doula role.
Yeah, I remember I had to do the same thing. Yeah. I miss it at times, but I do not miss being on call. I do really miss the births. So
I miss the births. Oh, there was something. Someone once asked me, what is it like to attend a birth as a support person? The only thing I could say was, it's the most intense meditative practice I've ever done. And
yes,
I love
time passes so fast and so present at the same time. It's otherworldly. It's like
thing. All those niggling little squirrel mind thoughts that are just always yammering in the background. Somehow in the birth room, there's a loud enough other voice that's able to say, you are going to go sit over there and not bother me while I focus on what this mom needs in front of me right now.
Yeah, because it's so about giving and attending to the other person that your own thoughts don't even have space. All right, so let's jump in because I'm really excited. So we're going to talk about that investigation of education. So before we jump into the role of doula, because I actually think that's one of the later steps. I don't think it has to happen right away, because before you do that, I think the birthing person needs to first understand what kind of birth they want, what kind of support, what kind of care provider. Because if they don't know that, hiring the doula may not be the best fit. So
Totally.
I guess that's going to lead us to the talk of the importance of education. So I'm going to throw it to you. Let's start with childbirth education and why it's important.
Right. Why should you take this class in the first place? Well, so this is the thing. I think everybody has a picture in their head of what they think childbirth is. And everybody has an idea of what they expect is going to happen, what they're going to get when they walk into their hospital, birth center, etc. But especially if this is your first time through this, you've never actually been in that environment. And we don't actually know what the options are. We don't actually see how the conventional way of treating birth is in the medical field. We don't really know even necessarily what is physiologically happening in the body sometimes around it. You can certainly pick up books, but, and I think my book is fairly well versed on this, but it can be a bit daunting to go into Amazon, type in childbirth education or childbirth. I mean, you're faced with a wall of information, and some of it you do need to know, and some of it you need to know, but not necessarily in the minutia details. And some of it is presented in a way that really isn't going to give you a clear picture of, is this the way I want to birth, or is this just a really sensationalized and sort of catchy way of talking about the birth experience, but in fact, this isn't what many people have, or this is not what I need to have necessarily. So I think it's really key that we find a class that, and it might be multiple classes, if we're going to be fully honest here, but we find the class that helps you understand what are your options based on the different specifics of your pregnancy, your birth, your area, your preferences for labor and birth.
Yeah, because you can't make choices if you don't know what those choices are.
Exactly. If you don't know that you had the option to eat and drink in labor, and your hospital has a quote unquote policy that you have only clear fluids, you would never know that you can push back on that. You would never know that you can decline an IV.
Or something as important as alternative birthing positions, that there's a variety out there. And if you didn't realize that, you might be on your back, and that could cascade down to your sacrum can't move, baby's not coming out, and they'd be like, oh, something's wrong with my body, when it might have had nothing to do with your body, but just changing the configuration of how your pelvis is organized. And if you don't know, that can just spiral out of control.
Yeah. I think a lot of folks in our culture, they arrive at sort of pregnancy and preparing for the birth experience, and the only real quote unquote education we've had might be the movies. It might be,
and that's not a good,
and that's not accurate.
Do you know something which is funny? I had somebody leave me a DM in my Instagram, and they said, I'm really appreciating your account because I'm writing a screenplay and there's birth in it, and I wanted to get a better representation. And I was like, oh my God, I'm happy. I was so, like, my jaw dropped. I was like giddy like a child. My husband's like, what is going on? And I'm like, someone wants to do a realistic, I have no idea besides that connection.
We'll watch for Hollywood better representations of the birth experience.
Because if that is all that folks are learning, it is very skewed and really often either for comedy or fear.
Exactly. I usually tell them when I'm teaching hypnobirthing classes, we'll go through a little exercise. If I say, what comes to mind when you think of birth? And we get, a huge list of things. And then I say, now, where did you get this from? People say, the movies and TV and my friends' stories. And I say, right. Remember that birth on TV is geared and cultivated and curated for one thing very particularly, keep you on the channel till the next commercial break.
Yeah.
It's the most boring television when you're seeing uncontrived birth. Oh, it's so dull.
Yeah, you're not going to stay there and be like, ooh, what's next?
Someone's
All right,
breathing.
so we're
Ooh,
understanding options. So now that we understand the importance of knowing one's birth options, let's go a little even deeper.
Yeah.
So someone knows their options. We have the material out there, but then that same person needs to start to think of themselves first. Like, what are my priorities and desires for my birth? So what kind of questions should they even be asking themselves? Okay, this is kind of a two-part question. Sure. So what are questions they should ask themselves to be like, okay, I have this information, but now what do I do with it? Yep. And then once they've figured out their priorities, what are the kind of questions they should prepare to ask their care provider to make sure they're a good fit?
Right, because you need to make sure that you are aligned with the person who's overseeing your interface with the hospital in that way. So, I mean, for yourself, one of the first things I have my students do is I say, sit down. Now, let's just imagine for a moment that you're healthy, baby's healthy, and there are no medical complications. If that's true, then you can now, just for a second, magic paintbrush. You can paint exactly the ideal birth that you'd want to have. What do you want? And I actually let them sit there for a second and I said, you can have it. What do you want? List it. And people will, take a second. Usually people say, I'd like something calm. I'd like something quiet. I'd like something peaceful. I'd like something intimate. And I say, okay, go deeper. Where are you? Oh, well, it's a warm room. It's a dim room. And then you throw the question. I throw the question out. Is it a hospital? Oh, yes, it's a hospital. Okay, good. You've actually got you've got a point there of you are actually wanting to birth in a hospital. Good. Then you should birth there. Or what kind of who's with you? What are they saying? And I sort of walk them through a little bit. But if we go by our senses, we can kind of get a picture of what's our ideal birth. Mm-hmm. And then we can go from there and say, all right, now we can't necessarily guarantee that everything's going to go perfectly. So if everything isn't going perfectly, and this is the question I feel like we often miss, especially in creating birth preferences, what does support look like for you? What is it that would feel like support? Is it people holding you? Is it people talking? Is it people giving you options and talking through benefits and risks and alternatives? Or is it people not throwing too many pictures at you and more saying, you got this, we believe you, we trust you, and we're just watching this piece over here. You're fine, keep going with that. So that because I think the thing that we miss a lot of times in thinking about our birth experiences is, what is the feeling I want to come away with? Everyone says I want to be satisfied, I want a healthy and a happy baby, I want to, not be traumatized. Okay, but that doesn't tell me how to actually support you. Does that mean I had a student once who I remember us talking through what type of birth are you looking for? And she went through the surface level and I said, go deeper. What do you want? What would it look like for somebody to be supporting you in that experience? And she said, I really want them to tell me all of the options, but then I want them all to leave the room and trust that I will choose what's right.
Oh, I like that.
And I said, write that down because listen to your voice when you say it. You're powerful in that moment. You need to find the way to get that from your provider.
I like that because, you might have someone that wants all the choices. You might have someone on the other side saying, I get overwhelmed by choices, so only give me 2 choices.
Exactly. And doctors do not mean to overwhelm us. They feel they're offering, well, we have this expert possibility and there's this possibility. They have this whole rainbow cornucopia of possibilities that they could offer. And it's helpful for them to know, actually, I get overwhelmed. I really don't want you to offer me something unless it is absolutely medically necessary that we do it. And if you're required to offer it, I want you to say, it's been X number of hours. I'm required to say, do you want Pitocin? I don't think you actually need it, but I am required to say it at that moment.
And so once the person can really dig deep enough to understand their priorities and desires, then they have a vision. And again, you and I both know that it has to be, I call it like birth plan ABCD. Like you have to be fluid with that. But priorities, as in helping make decisions, that doesn't have to change no matter how the birth's unfolding.
Exactly.
So then talking to the care, like finding a care provider that's like, yes, I see that you get overwhelmed by this, or, I hear that it's really important for you to be part of the informed decision making. Right. That doesn't need to change whether someone's being induced, has an epidural, has a cesarean, like all those foundational, I'm going to say values can be the same. So then how could somebody start to head into their care provider and have that open conversation? What would some of those questions be?
So, I think one of the first questions we should ask our providers is, why did you go into birth? Same when you asked me.
That's interesting.
Why did you go into birth? What is it you find really rewarding about the birth experience? Because that's going to give you a picture of, what is your provider excited about? What is it that they really lean towards? And if I remember, I had a friend, she was in medical school and we were chatting and she said, I'm going to go. She's like, I'm going into obstetrics. And I was like, really? Tell me what is the most exciting part about obstetrics? And she looks me straight in the face and says, the surgery is so fascinating. And I thought, oh no, you're going to be one of the doctors that I don't send clients who are looking for a natural birth to, because you're not excited about the physiology of the birth process. You're excited for the surgery. Oh dear. Oh, well, okay. I'm glad you are going to be the excited one. You can be the one that helps the people who need the planned cesareans, but it was just sort
high
of
risk. Yeah. That's interesting. I never thought to ask that question. All right. So that is a great question. What else might somebody
the other thing is, if you've got a picture of what type of birth you want, I always say, start describing it to your provider and see how they respond. If I'm really envisioning that I want to have alternative birthing positions. I really want to be able to choose what position I'm pushing in and even what position I'm birthing in. How many of your patients, clients, people you work with birth in alternative positions? And I always think it's
I got a little smile on my face because I'm like, I have a sense of how many of them are going to react.
Yes. Well, but I think it's always good to phrase it that way. How many of your clients have needed episiotomies? How many of your clients have needed to be induced? How many have needed a cesarean? Because one, it tells you what type of birth is this provider most familiar with. What is the one that they are usually going towards? Because what we're familiar with, we're going to be more comfortable with by and large. And then the other side is, if they tell you that 60% of their clients always need to be induced, that tells you something about how quickly they are likely to induce for something. And if you go to another provider and they say, we only have a 20% cesarean rate, and we only have a 20% induction rate, that tells you something different about that practice. But I think the actual biggest thing for talking with your provider, ask them specifics about what it is that you want. Ask them, I'm thinking about not having an IV. I kind of was thinking I might drink water, and if I need an IV, we'll talk about it then. How do you feel about that? Watch how they respond and check your own gut about how you feel about that response. I always tell students, if you walk out of your provider's office and you feel dismissed, you feel placated, you feel like you were not listened to more than twice, you really need to think carefully about whether that's somebody who's going to actually support what you want in the intensity of labor. Because if they're not doing it when you're not in labor, why would we assume they're going to when the emotions are running high?
Mm-hmm. I really like that. And I really like those questions. And again, going back to that first step, because you and I have both had students that maybe getting pregnant was a huge struggle and they want a lot of management because that's what's going to feel safe for them.
Yep.
And they need that type of doctor that's like, yeah, this I practice. And because they might feel like, no, I want full-time external fetal monitoring because I'm going to feel safer with that. And if you have a doctor that's like, I do the Doppler, intermittent monitoring, which we, I won't go too much into it, but we do know that's what
actually better.
ACOG World Health Organization says. But again, I really think if someone is going where someone feels safest, then their nervous system is going to let their birth flow.
Exactly.
So we honor that. So having really sat with yourself and come up with your honest, what am I going to need to let my guard down? That's the kind of care provider that they need. Oh, I'm loving this. Okay, we have to take a break. When we come back, I have more questions. All right, we'll be right back. Okay, we're back. So now I'm going to tie this into what Deborah Pascali-Bonero said about a doula should not be your sword and shield when heading into a birth. So when you were attending births, what have you seen when you were hired as a doula because the client felt they were not comfortable with their care provider? So like, I remember being there. I'm like, oh, I am stuck in a sticky place because this is not a good match. And I was only hired to try to fix things. And a doula cannot do that.
No.
So what have you seen happen when that happens?
We can't get between you and your provider. If we do that, it's a recipe for getting us thrown out of the room real fast.
And discourse throughout for everybody. Because if the birthing person needs to be in that birth flow and feel safe, if there's discourse in the room, that is not going to make them feel safe.
No, that's true of us just as women. It's a cultural thing. We are conditioned to focus outward. We're conditioned to take care of others and make sure others feel good before we take care of ourselves a lot of the time. So if the whole room is in this completely contentious discord, uncomfortable, everyone's stressed out and snipping at each other, mom can't relax. And that's just not going to help anybody. And I remember thankfully there weren't too many that I remember where I actually got to the birth room and went, oh boy, we are not in a good place. But it's really awkward because it puts me in the position of having to speak up. A lot of times what would happen would be I would be speaking up and I'd have to actively turn to her and almost pull her out of her birthing world to say, right, Mom, I can't speak for you here. This is where you had said to me that you wanted this feeling. Is this? And of course, Mom's not in a state to assert herself in that moment. And so I would just kind of be sitting there going, I would like to have helped here more. I would like to be able to get in to this, but you're not comfortable. You don't feel safe with this provider. And it never goes as smoothly. The providers mean well, but it's what does it look like to support you? They mean well. They're supporting the birth. They're supporting a different birth than she's having. And in those moments, if I can, I'll pull the provider aside and almost go a little buddy-buddy with them to try to make them think, oh, I'm on your side more. And then I can go back to Mom and say, okay, I think she'll listen to what I'm saying, but I need you to actually drop in. If you're going to do that, then go do it. I will hold the boundary for you. but it means that the provider is constantly trying to get past me, and it's not a cooperative relationship when that happens.
Yeah, no, I've been, luckily not many, but it has been very uncomfortable. So let's talk about ways that a doula can be an advocate, but then also times that a doula, they can't because it's going to go outside their scope of practice.
Yeah. And I think it's an important point because there are doulas out there who aren't comfortable with actually stepping into the advocacy role. I think it's a key part as a doula because we do see the backside of what's happening in the hospitals. We do know which providers are a little quick to grab the scissors or which ones are a little quick to jump into the Pitocin train from that. So things that we can do as an advocate, we can remind the staff, we can remind the room sort of about what her preferences were. We can say, and remember everybody, we're doing delayed cord clamping, right? She wanted to have this. Yes. Okay. We're all good. Yes. In that way. So it's collaborative, but we are speaking up. I do remember one, it was not the greatest relationship, but mom was crowning. The doctor was planning to do an episiotomy, I'm pretty sure. And mom had not consented to that, and she really didn't want one. And I basically said out loud to her, hey, Mom, I noticed that Dr. Y has some scissors out. Do you want to ask anything? And just kind of sat there. I got such a glare eye from the doctor, but that's an advocacy place. Where it's over the line is if I had said, you're not allowed to do an episiotomy, or to say to her, you don't need an episiotomy. I as a doula, we don't know. We're not trained to make a medical assessment about whether something is appropriate or not. We need to get mom and partner the information and then maybe say, okay, is it possible for her to have the room for a moment? She really we've talked, and a lot of times she likes to have a little space. Could we have the room for a moment just so they can have a second to think about their options? Okay, I will come get you immediately as soon as they've made a decision. And no, we won't take that long.
Do you remember Terry Richmond? She taught it.
Yes.
Okay, so she was my doula for both my birth, and she was my mentor. And back when I was a doula, she was my backup. How blessed was I to have Terry as my backup? But she taught me something that I used, and I still pass on to my students and stuff. If they say, we need to do this, and they say, can we pray on this? I started using that. You would not believe how quickly someone leaves the room.
Oh, I like
if you say the word, we need to pray on it. First of all, they're not going to, unless it's an emergency situation, then they're like, no, you cannot, because, like a real emergency.
Right.
But most of the time, they're going to be like, yes, go pray on it.
That's what when I teach childbirth classes, I'll say that I call that playing dumb as a fox.
Yeah.
Where you say something and, do we need to do something right now? Is the baby in danger? Is mom in danger? And, all they're saying is like, we'd like to start Pitocin maybe from this. But if your reaction is beyond, they're like, oh, no, everything's fine. And it's sort of like, oh, okay, you just said everything's fine. So then what was it you wanted to do again? But I love that idea.
We need to pray. We need to pray on that.
Can we have a moment to pray on that? Can we meditate on this for a moment?
Yeah, but for whatever reason, pray. I can, at least in the New York City area, it got people out the door. They're like, yeah, pray on it. It's fine. I'm getting out.
Well, and especially these days, prayer, and if we bring spirituality into it, it gets into that kind of emotional, awkward place that I think the medical folks don't really want to hang out in.
Yeah, so it clears the room.
It clears the room very, very quickly.
And that's great, because that way people can regroup and then come up with a plan of how to advocate for the birthing person's wishes.
Right. And I think that's a key thing for people to know. we all sort of think, oh, well, all the medical people are in here and they're offering these things and I have to make a decision right now and I have to make it in front of them and I don't get you. If it's, as you say, if it's not an emergency, and even if it is, honestly, you are allowed to ask them to step out. We are allowed to take a breath and take some space and have that moment, as you say, to recenter ourselves and then strategize a little bit. And that's where a doula, we have to watch our scope of practice. We don't get to say, you don't need this. This is not something that you should be doing. That's outside scope. But to say, what do you think? What does your gut say? What's your intuition, the eye and brains? Benefits, risks, alternatives, intuition, not now. Or a friend of mine also says next steps. If you're thinking about an intervention, what would be the next steps if we decided to do this so that you know what's coming? And then can we have space to think about it?
Oh, I like that.
So
all right.
important.
So let's talk about some red flags. So what are some red flags that the birthing person may not be aligned with their care provider or place of birth, and then having a doula may not give them the birth they're hoping for? And that goes back to like the doula cannot be the sword and shield. So what are the red flags ahead of time?
Yeah. And I love that way of saying it. The doula can't be the sword and shield. I mean, really, if we think of this from the jousting perspective, you got a sword, you got a shield. The doula should be either your squire or your horse. She's not going to be there taking the blows or combating.
First of all, I love that you. Okay, so this goes into that. I know, Bec, because you've got to how many Renaissance fairs? So the fact that you're like the squire and the horse, like, of course you went there.
Of course I went there. Of course, doula is your horse or your squire. I think she's your squire because I don't want to be carrying anybody. So, I mean, one of the things, and we mentioned it in talking with your provider, if you're talking with your provider and you feel dismissed, you feel not listened to, you feel that they're just kind of patting you on the head saying, yes, dear, absolutely. They're not listening to you now. A doula is not going to be able to get them to listen to you in labor if they haven't been beforehand. So that's the first one is, are you able to have a really solid, productive conversation with them where your provider is asking questions like, how can I better support you in these choices? If something needed to happen, how can we work together in this? Because you are a team. The other one I always get worried about when people say that their provider is consistently using language like, well, we'll see.
I was going to say that we'll see.
Oh God. Or we'll try. I always say Yoda was right. It is do or do not. There is no try in this. Let's give it a try. Well, how about let's do it? How about I will support you in this?
That is so different, especially I think of like VBACs. I will support you in this, or we'll try. So different in intention and not just determination, like, I guess belief in oneself. Yeah. Like, we'll try feels a little contrite, and I'll support you in that means like, I'll show up and support you. And of course we will see what happens, but I believe in you. I can't promise the outcome.
Right. I can't promise the outcome, but I got your back for doing this.
Yeah.
And that's the thing. A doula is there as, I say, doula, we want our doula to be the mom we wish we'd had, because not everyone has the best relationship with their actual mother. But a doula's role is almost to allow mom to be the mother for herself. And if we're doing that, we can't completely change the environment, hospital, people around you to make it shift into a different environment. If you were looking for a super duper spa environment and you've chosen to birth in an unbelievably high intervention level, conservative, medicalized hospital with a really high intervention rate provider, you have not set yourself up for success. And the doula is not going to be able to shift the whole picture. She might make it a little less traumatic. I didn't want to go to that word, but let's go there. She might make it a little less crummy, but she's not going to get you the birth that you're honestly looking for.
Yeah. Yeah. And that goes back to the beginning of our conversation of sit with yourself, be realistic and honest with yourself, and then build it out from there.
And own your own choice. If you want an epidural, go get the epidural by all means. And then maybe also learn what you can do to make an epidural and still be active with the epidural. And
that's actually where I think people get confused about doulas, because I actually I never remembered my stats, but having a lot of people with epidurals and be like, but we still can position you and be active. So, knowing like every 5, 6, 10, contractions move you to help things move along. Getting an epidural doesn't mean, we don't need a doula. I actually think you need a doula sometimes more, because it's easy to be forgotten. Like, oh, that, room 10 has an epidural. And then they just get forgotten and nobody's helped them adjust positions or, explain what's going on.
Yeah, I think that is a big misunderstanding. If you get a doula, that does not mean you are locking in for the natural birth experience. That you got a doula so you could avoid a cesarean. This might be, I was a doula for several planned cesareans, because they wanted somebody there to help them stay in a calm, regulated state. And they wanted someone to help with bonding in a birth that was not going to have the usual baby emerges and immediately goes straight to mom's chest kind of thing. So doulas have incredible skill sets that go way beyond just the breathing and the positioning for a natural, unmedicated birth experience. And I agree with you. Sometimes if you're planning to use the medication, you almost want the doula there to mitigate the side effects that some of those interventions can come with.
Oh, that's a great way of saying it. Okay, we're going to take another break. When we come back, what is one final tip or piece of advice you'd like to offer new and expectant parents? I'm very excited to hear this, because you have so many different, as you and I were talking about before we started recording, you and I have so many initials that we're just like birth junkies. So I'm so curious which mindset you're going to come from with this. Okay, we'll take a break. Chew on that for a moment. We'll be right back. Okay, we're back. So what is one final tip or piece of advice you'd like to offer new and expectant parents?
And there are so many. To bring it down to one is actually quite difficult for both of us, I'm sure. Yeah. So I couldn't come down with just one. My first one is, honestly, do your research and find support beyond just the day of the baby's birth.
Yeah.
This is one day. We prepare you. You're taking all these incredible classes to learn your options and find your birth doula and your, squire who's going to help you through the birth experience. And then you're going to have your baby. And then you have your baby. And that's, as you and I both know, as mothers of small and slowly growing larger children, that's when the real work starts, is you have a child. And we need support for the birth. We need support after the birth. And really gather the village around you. And the other piece, which is sort of in tandem with that, is in gathering that village. If you're interviewing doulas and you're taking childbirth education classes, these folks have the inside scoop on what goes on at your birth facility. They know who your provider is. They probably have some inside info. Ask what they've seen. If you're looking for a particular type of birth, ask who their favorite providers are. You might find out the sort of inside information about who's the most amazing provider that you wouldn't have thought is really going to be good in the birth room, and who's the amazing provider who's great in the prenatals, but when it comes to the labor, actually, that's not the one you want to have. You want this other one.
Oh, I really like that tip. That is good. Bec, where can people find your work?
So my website is omebirths.com. as in OMBIRTHS.com. And all of my stuff is listed there. The book, The Om Births Approach, came out last year and it's available on Amazon. And if you're in the Boston area, I have a couple of in-person classes out here near my house in Framingham, but all my stuff is online. So there's live stream classes, there are recorded libraries, there is stuff for prenatal, there's stuff for postnatal, there's pelvic floor work. It's a whole wonderful cornucopia smorgasbord that people can find.
Wonderful. I've been at your site and just everything is wonderful. Bec, as always, I just love speaking with you. Thank you for your time.
I'm so glad to talk with you again, Deb. This is just, it's talking about our favorite topic, which
it really is. Thank you.
This has been an episode of Yoga, Birth, Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.